Our patient is a 24-year-old female who suffered a left CVA and as a result has right hemiplegia, and they have a flaccid right upper extremity. This person currently has lack of motivation from the fact that they don't believe what they're doing now is going to help them pay off. Some of the body functions that they, I guess, are limited in is lack of attention, difficulties and deficits in perception, decreased energy levels, altered proprioceptive functions and vestibular functions. They have unstable balance, decreased range of motion to that right side, decreased muscle strength and endurance, flaccidity, and lack of hand-eye coordination. Some of the performance skills are motor-related, lack of stability, loss of balance at times. Reaching is difficult. There's difficulty with two-handed activities, and endurance is decreased. Process skills are the inability to attend to every task without distraction, decreased concentration, and an inability to initiate without verbal cues and physical assistance. Social skills, they frequently are unable to produce speech that is audible. They have inconsistency with fluency during their speech. They have a lack of eye contact and an inability to consistently reply to questions and comments. The techniques that we're going to show you are the Babbitt and the Brunnstrom. For the Babbitt, my patient is going to be instructed in how to properly position to go to sleep. So they are going to, we're doing this to help normalize tone and also to increase sensory input. So the preferred side, because it's their right side, is to lie side lying on that right side. Their unaffected leg, so their left leg, is going to be stretched across a pillow. The affected hand, so the right hand, is going to go underneath the pillow, underneath their head. The shoulder will be protracted with a 90 degrees of flexion, and the forearm is going to be supinated, and the elbow is in a flexed position. From here, they're gaining, again, the weight bearing, the trunk rotation, they're getting sensory input, and hopefully normalizing tone. The next exercise that we're going to be doing is the Brunnstrom, and we're going to switch patients.
Okay, so for the Brunnstrom, it is also bed positioning. So we're going to be assisting with proper positioning. So the individual should be placed in a supine position while they're in bed. Next, the hip and knee will be slightly flexed with a pillow underneath the knees for support. Support should be faced on the lateral sides of the lower extremities to prevent hip abduction and external rotation from occurring. For the upper extremity, the affected arm is placed onto the pillow in a position that is comfortable for the patient. Upper extremity abduction should not occur. Individual will use the unaffected arm to assist the movement of the affected arm. So the Brunnstrom is, the principles of the technique is to facilitate progress to the recovery stages, currently in the flaccid stage. So proper positioning, use of the unaffected extremity to assist movement of the affected side, avoid contractures and pressure sores. And that is all that we have.